In today's video, we're going to talk about the hidden warning signs your heart may already be sending you. Imagine this: your body could be giving off signals right now, signals that might save your life, yet most people brush them aside without a second thought. Heart failure is not rare. In fact, more than 64 million people worldwide are currently living with this condition, and in the United States alone, over 6 million adults face it every year. What's even more alarming is that the majority don't recognize the danger until it has already progressed too far. Scientific studies consistently show that people tend to dismiss the earliest symptoms as nothing more than stress, fatigue, or simply getting older. But in reality, these are not harmless inconveniences. They are urgent messages from your heart that something is wrong. That's why today, we're uncovering 13 subtle yet critical early warning signs of heart failure that are often overlooked. Some of these clues may surprise you. It could be something as ordinary as feeling short of breath when leaning over to tie your shoes, or suddenly realizing you can't lie flat in bed without reaching for extra pillows. By the end of this video, you'll know the exact signs to pay attention to and when it's time to seek medical care. Before we begin, remember this: what you're about to hear is for educational purposes only and should never replace professional medical advice. Every fact we share is backed by peer-reviewed research, and references can be found in the description. Now, let's start with the very first warning sign that could reveal your heart is in trouble. 1. Cold hands or feet. Let's begin with the very first signal your body might be giving you: changes in your circulation that show up in your hands and feet. If you notice that your fingers or toes feel unusually cold even when the weather is warm, or if they take far longer than normal to warm up, it could be your heart struggling to pump blood effectively. In many cases of developing heart failure, the body redirects blood flow toward the most vital organs, the brain and the heart, while reducing circulation to the extremities. This can result in hands and feet that stay persistently cold, sometimes with a bluish discoloration of the lips or nail beds. Another clue is something called a narrow pulse pressure, which refers to the difference between the top and bottom numbers of your blood pressure reading. Normally, there should be at least a 40 millimeters of mercury gap between systolic and diastolic values. When that gap becomes much smaller, it signals a reduced stroke volume, meaning your heart isn't pushing out enough blood with each beat. Research published in leading cardiology journals highlights that these subtle circulatory shifts often appear gradually, yet they can be among the earliest measurable indicators of declining cardiac output. In fact, studies estimate that more than 30% of patients who later develop heart failure recall noticing persistent cold extremities months before more obvious symptoms began. 2. Abdominal bloating. At first glance, digestive problems may not seem connected to your heart, but symptoms like chronic bloating, loss of appetite, or feeling overly full after eating just a few bites can actually be among the earliest clues of heart failure. This happens because heart failure isn't limited to the heart alone. It disrupts the entire circulatory system, including the blood supply that keeps your digestive organs functioning normally. When the heart's pumping ability weakens, circulation to the gastrointestinal tract is reduced. At the same time, excess fluid can build up in the abdominal cavity, and the liver often becomes congested as blood backs up instead of flowing forward efficiently. Together, these changes create a chain reaction of digestive issues that gradually erode daily comfort and quality of life. Studies reveal that such gastrointestinal symptoms are frequently underestimated by both patients and doctors, since they don't initially appear to point toward a heart condition. Many individuals describe feeling full after only a few spoonfuls of food, struggling with ongoing nausea, or battling persistent bloating that doesn't improve with standard digestive treatments. Liver congestion tied to heart failure can also lead to discomfort or pain in the upper right side of the abdomen. For some, it feels like a constant heaviness or pressure in the stomach that makes eating difficult. Research has documented that up to 20 to 30% of patients with chronic heart failure experience these abdominal symptoms, often months before more obvious cardiovascular warning signs appear. 3. Dizziness or near-fainting episodes. Feeling dizzy, lightheaded, or on the verge of fainting can be an alarming sign that your heart is in trouble. These episodes happen because a weakened heart cannot push enough blood to keep the brain properly supplied, especially when the body is under stress or during quick changes in posture. Normally, when you rise suddenly or exert yourself, the body compensates by increasing the heart rate and tightening the blood vessels to stabilize blood pressure. In heart failure, however, this mechanism doesn't work as it should. The result is a brief but dangerous drop in blood flow to the brain, which can leave you reeling, lightheaded, or in more severe cases, cause you to pass out completely. Research shows that about 1 in 5 patients with heart failure, nearly 20%, experience episodes of syncope, sometimes long before other classic warning signs appear. These incidents are often triggered by everyday situations such as getting up too quickly, standing still for extended periods, or even mild exertion that once felt effortless. The real danger lies in misinterpretation. Many people blame dizziness on dehydration, the side effects of medication, or inner ear problems. While those causes are possible, when these symptoms occur alongside other red flags of heart failure, they point to a significant decline in cardiac output. In fact, large-scale studies published in cardiology journals have found that patients with recurrent fainting episodes have nearly double the risk of hospitalization compared to those without, underscoring the importance of not dismissing this symptom. 4. Palpitations or irregular pulse. One of the earliest warning signs that something may be wrong with your heart is a change in its rhythm. Palpitations, the unsettling feeling that your heart is fluttering, pounding, racing, or skipping beats, often appear in the initial stages of heart failure as the heart struggles to keep blood flowing effectively. When the heart muscle begins to weaken, it can no longer maintain a steady rhythm. You might notice your pulse quickening even when you're at rest, or feel as if your heart is lurching, missing beats, or flipping inside your chest. Many patients describe the sensation as though their heart is tumbling or performing somersaults. Extensive research from leading cardiology institutions has confirmed that arrhythmias, especially atrial fibrillation, play a dual role in heart failure. They are not only a frequent complication but also a contributing cause. This two-way relationship creates a dangerous cycle. Irregular rhythms can push the heart toward failure, while heart failure itself can spark new arrhythmias. Studies estimate that up to 40% of individuals with chronic heart failure develop atrial fibrillation, and this combination is linked to a significantly higher risk of stroke, hospitalization, and early mortality. Palpitations often become most noticeable during periods of rest or while lying down, and they are frequently accompanied by anxiety or a deep sense of unease. Although many conditions, from caffeine intake to thyroid disorders, can cause an irregular heartbeat, when these sensations appear together with other warning signs of heart failure, they should never be ignored. Immediate medical evaluation is essential, as timely treatment can break the cycle and prevent the condition from rapidly worsening. 5. Night cough. A cough that lingers through the night or appears mainly when you lie down may seem harmless, but it can actually signal early heart failure. Unlike the wet cough of a respiratory infection or the itchy dryness of allergies, this one is often described as a stubborn, hacking cough that keeps you awake until you sit upright, where it noticeably eases. The cause lies in the same mechanism behind orthopnea. When you're flat on your back, fluid that is pooled in your tissues throughout the day redistributes, and some of it seeps into the lungs. Even a small amount of this fluid buildup is enough to irritate the airways, triggering your body to cough as though it's trying to clear an obstruction. Clinical reports note that this nocturnal cough is usually most pronounced in the early morning hours, sometimes accompanied by a faint wheeze. Many patients say the cough brings up little or no mucus, though in some cases a frothy substance appears, white or even pink-tinged, clear evidence of fluid in the lungs. Research indicates that up to 1/3 of heart failure patients report this kind of night cough before other classic symptoms are recognized. What makes this warning sign particularly tricky is that it is often mistaken for something else: seasonal allergies, postnasal drip, or even poor sleeping conditions. But when the cough occurs regularly in the night and improves only when you change position, it may be your heart revealing a problem long before you realize it. 6. Nocturia. Waking up multiple times at night to urinate may seem like a simple nuisance, but it can actually be an overlooked warning sign of heart failure. This condition, known as nocturia, occurs when the need to urinate becomes more frequent during the night than during the day. While many people blame aging or evening fluid intake, the true cause may be linked to how well the heart is functioning. In the daytime, as you remain upright and active, gravity pulls fluid down into the legs and feet. When the heart is weakened, it struggles to push this excess fluid back up to the kidneys for removal. But once you lie flat at night, gravity no longer holds the fluid in your lower body, and it flows back into circulation. This sudden shift forces the kidneys to work harder, producing more urine and waking you from sleep. Studies in cardiovascular research show that nocturia may appear earlier than other hallmark symptoms of heart failure, even before swelling in the legs or shortness of breath is obvious. Patients commonly describe waking 3 or 4 times per night, each time passing a larger volume of urine than usual. What makes this pattern so important is that it reflects the heart's reduced ability to manage normal fluid balance across a 24-hour cycle. Far from being just a minor inconvenience, repeated nighttime urination can be one of the body's earliest signals that the heart is under strain. 7. Rapid weight gain. One of the clearest early indicators of heart failure is an abrupt rise in body weight caused by fluid retention. This isn't the slow, gradual gain that comes from extra calories. It's a sudden jump that unfolds over just a few days and should immediately raise concern. Updated clinical recommendations from the American Heart Association warn that putting on 4 pounds within 24 hours, or 6 to 7 pounds across a single week, is a serious red flag that requires prompt medical attention. The reason is straightforward: as the heart weakens, it sets off hormonal changes that signal the kidneys to hold on to salt and water. Every kilogram added on the scale reflects nearly an extra liter of fluid trapped inside the body. Research confirms that this type of weight gain often shows up before more recognizable symptoms like swelling in the legs or difficulty breathing. That's why cardiologists strongly encourage patients with heart failure to weigh themselves every morning. Tracking these changes can act as a life-saving early warning system, helping to prevent emergency hospital visits. Unlike normal daily fluctuations, this gain is steady, persistent, and usually comes with a sense of bloating or abdominal fullness, making it a key sign that the heart is struggling to cope. 8. Ankle or leg swelling. Swelling in the lower limbs is often one of the earliest physical changes that signal heart trouble. Known medically as peripheral edema, this type of swelling is not the kind that fades after a short rest. Instead, it is steady, progressive, and tends to grow more pronounced toward the evening hours. When the heart's pumping action weakens, blood flow slows and pools in the veins of the legs and feet. In response, the The kidneys, receiving less blood than normal, retain salt and water, which further drives fluid into the tissues. The result is visible swelling that becomes increasingly difficult to ignore. Updated clinical data show that nearly 3 out of 4 patients with newly diagnosed heart failure exhibit some form of peripheral edema. It often begins subtly at the ankles and feet but can creep upward into the calves and thighs over time. People frequently notice deep marks where socks press into the skin, or find that shoes fit well in the morning but become uncomfortably tight by the end of the day. What makes this swelling distinctive is its symmetry and persistence. Both legs are usually affected in a similar way, and pressing on the area often leaves a noticeable indentation that remains for several seconds. Far from being a cosmetic concern, this is the body's way of revealing that the heart is under significant strain and failing to keep circulation in balance. 9. Fatigue. One of the easiest to brush aside is relentless fatigue that turns even the simplest tasks into a challenge. This is not the kind of tiredness that fades after a good night's sleep. Instead, it is a deep, ongoing exhaustion that lingers day after day, making once enjoyable activities feel draining or even impossible. When the heart can no longer pump efficiently, the body prioritizes blood flow to the most vital organs, the brain and the heart itself, while reducing circulation to the muscles. With less oxygen-rich blood reaching them, your muscles weaken, leaving you feeling depleted. Recent clinical studies suggest that this type of fatigue can appear as much as 6 to 12 months before more obvious symptoms of heart failure are detected. One of the most troubling aspects is how it erodes exercise tolerance. Recovery after physical activity takes much longer than it used to. A short stroll that once felt refreshing might now demand an extended rest. Everyday tasks such as climbing a flight of stairs, carrying groceries, or even showering may leave you worn out. The change often creeps in so gradually that people unknowingly adapt, reducing their activity levels, making excuses, or blaming age. But this steady decline in stamina is not simply part of getting older, it is your heart signaling that it is no longer meeting the basic energy needs of your body. 10. Shortness of breath. And finally, we come to one of the most overlooked yet telling signs of heart failure: shortness of breath during everyday activities that once felt effortless. This isn't the breathlessness you'd expect after a long run or strenuous workout. Instead, it's finding yourself winded after climbing a single flight of stairs, walking across the yard, or even heading out to the mailbox. What's happening inside the body is that the heart can no longer pump strongly enough to deliver the oxygen your muscles demand during movement. To compensate, the lungs work harder, leaving you feeling out of breath far sooner than you should. The critical distinction between ordinary tiredness and heart failure-related breathlessness lies in the progression. If tasks that used to be easy now force you to stop, rest, or recover, it's your heart signaling distress. Updated research from the American Heart Association and other large clinical studies confirms that exertional dyspnea is not only among the most frequent red flags but also one of the earliest to appear, often surfacing months before swelling, fatigue, or other classic symptoms. Statistics show that nearly 60 to 70% of patients later diagnosed with heart failure recall experiencing unexplained shortness of breath well in advance of their official diagnosis. That's why this subtle change should never be dismissed as simply being out of shape or just getting older. It may be your heart's final warning call for attention. And if you found this video helpful, please hit the like button, share it with your loved ones, and subscribe to our channel. Your support helps us continue to bring life-saving health information straight to you. Together, let's take charge of our health and protect the most vital muscle we have, our heart.